Over 50,000 nurses at the moment are walking out of hospitals across New South Wales. This is despite the Industrial Relations Commission ruling the action illegal over concerns of patient safety. Our senior reporter is outside Premier Chris Minns' electoral office in Sydney, where a large rally is expected. Kenny, how long is this strike action going to last? It sounds like a party at the moment.
It does, yeah. They're certainly making some noise here right out the front of Chris Minns' electoral office in Cogra. It's going to last for 12 and a half hours, and nurses from all over Sydney have been bussed in here to take part in this rally, which is going to go for about an hour and a half. But this is just one of 16 taking place all across the state at the moment, including places like Coffs Harbour, also Gosford as well, Albury. So this is happening in stages throughout the day, and this is about conditions, but mostly they want a 15% pay rise over 1 year. The government's offering 10.5% over 3 years rather, and the government is locked into that. They're saying that's all we can afford. There's going to be no other offer coming. Here's more Chris Minns on radio this morning.
If we implemented a 15% 1 year increase in salaries, it would cost $6.5 billion. That's more than we spend on the entire police force.
Now, following on from that, I interviewed just moments ago the Secretary of the New South Wales Nurses and Midwives Association, and she says that that's just not right and the government is not negotiating in good faith.
That's simply not true. We know that that's not the cost of paying nurses and midwives a 12-month increase onto their salary at 15%. We also know that this union has worked with the government to try and identify savings and new revenue options. We've worked with Deloitte to identify 3 new initiatives that this government can implement that will help them be able to pay for this type of pay rise that is so desperately needed. I would say it's not good faith right now. We've had almost 4 months of discussions that have entirely hinged on 4 items that have no costs attached to them. It's things like whether or not nurses can get 2 days off in a row, and we can't even get agreement to that. This is why nurses and midwives are so angry.
Now, these rallies are in defiance of the Industrial Relations Commission that has deemed this action illegal, and a part of that is because of concerns over patient safety. The Health Minister of the state, Ryan Park, has warned that there's going to be significant delays today in hospitals for non-urgent or critical care patients, and non-emergency surgeries are going to have to be cancelled as well. So this is in defiance of that. The next step is they're in front of the Industrial Relations Commission, in front of the President on the 18th of September. The union is hoping that a deal can be sorted out before then, but this impasse with the government is likely not to be sorted out. And this is the first major walkout or mass walkout by nurses of this Labor government in the state. There was the coalition government, the former coalition government had mass walkouts, but this is the first in 2 years, Laura.
Kenny, thanks so much. That is the most festive protest I've seen in quite some time.